What to know about sex during pregnancy. Unless a doctor or midwife recommends otherwise, having sex during pregnancy is safe. Indeed, sex urge may increase during certain phases of pregnancy, and sex can have some advantages. A woman may realize that some positions are more comfortable for her as her belly grows larger. Openly discussing sex can help both partners enjoy sex during the pregnancy. In this post, we will look at safety concerns and risks, as well as advice for sex during pregnancy. We also talk about when you should avoid sex and how sex changes during the second and third trimesters. Is it safe to have sex while pregnant? Sex is not harmful to the fetus at any point of a normal, uncomplicated pregnancy. Strong uterine muscles, amniotic fluid, and a mucus plug that forms around the cervix protect the fetus. Some people believe that sexual activity or orgasms can harm the baby, raise the risk of miscarriage, or cause premature delivery. However, none of these are true in a healthy pregnancy. Is it possible for sex to cause labor? Many studies have found no link between vaginal intercourse during pregnancy and an increased risk of preterm labor or early birth. If a doctor believes a woman is at high risk, she may advise her to forego sexual activity during the pregnancy or only in the later stages. An orgasm or sexual penetration could cause Braxton Hicks contractions late in pregnancy. Braxton Hicks contractions are light contractions that some women experience at the end of their pregnancy. However, because these contractions do not suggest or induce labor, they are not cause for alarm. Best positions. People in their later stages of pregnancy should avoid positions that put pressure on the pregnant belly, such as the missionary position. The weight of the baby may exert extra strain on a woman's internal organs or major arteries if she lies on her back. A pregnant woman may feel more at ease in situations where she has control over the depth and speed of the penetration. Comfortable positions for a pregnant woman include being on top of her husband, spooning side by side, or sitting at the edge of the bed. Oral and anal sex. Oral sex is perfectly safe to continue throughout pregnancy. However, a partner should avoid blowing air into the pregnant woman's vagina, as this can cause an air embolism, which occurs when an air bubble blocks a blood vessel. Though rare, an air embolism can be life-threatening for both the woman and the baby. When should you avoid sex? A midwife or doctor may advise a pregnant woman to avoid sexual activity if she has experienced any of the following. Abnormalities with the cervix that may raise the chances of miscarriage or going into early labor with twins. A history of going into premature labor, significant blood loss, or unexplained vaginal bleeding, leaking amniotic fluid, the waters have broken, which may increase the risk of infection. Placenta previa, where the placenta partially or entirely covers the entrance to the cervix. Cervical incompetence, where the cervix opens prematurely. A pregnant woman must protect herself and her baby from sexually transmitted diseases, STIs. This includes using barrier contraception throughout all sexual activity with new sexual partners, such as condoms or dental dams. Hormones can increase a person's sex drive, especially in the second trimester. Pregnancy impacts people's sexual urges in a variety of ways, and there is no average reaction. A surge in hormones and increased blood supply to the genitals may raise a woman's sex drive, especially in the second trimester. Other people may suffer a drop in sex drive as a result of hormonal fluctuations, feeling less comfortable in their bodies, decreasing energy levels, or physical ailments. Pregnancy can also alter a pregnant woman's partner's sex drive. Thanks for watching.